హాయ్, దిస్ ఇస్ డాక్టర్ జాన్, డెర్మటాలజిస్ట్, ట్రైకాలజిస్ట్ అండ్ హెయిర్ ట్రాన్స్ప్లాంట్ సర్జన్. నా గురించి మీకు అందరికీ బాగా తెలుసు, రెగ్యులర్గా నా వీడియోస్ చూస్తూనే ఉన్నారు. ఇప్పుడు ఈ హెయిర్ ట్రాన్స్ప్లాంట్ అండ్ హెయిర్ రెస్టరేషన్ జర్నీని ఇంకొంచెం ముందుకు తీసుకెళ్ళడానికి ఐఎమ్ టీమింగ్ అప్ విత్ ఫ్యూ అదర్ డాక్టర్స్ హూ ఆర్ ఆల్సో వెల్ వర్స్డ్. అంటే ఎవరైతే ఈ హెయిర్ ట్రాన్స్ప్లాంటేషన్ ఫీల్డ్లో కొన్ని సంవత్సరాలుగా రెగ్యులర్గా సర్జరీస్ కానీ ఎస్ఎంపీస్ కానీ లేదా హెయిర్ లాస్కి అగెయిన్స్ట్గా మెడికల్ ట్రీట్మెంట్స్ ఇస్తూ ఉన్నారు. అటువంటి వాళ్ళను ఇంటర్వ్యూ చేద్దాం అనుకున్నాను. ఇలా చేయడం వల్ల కొత్త కొత్త పాయింట్లు కానీ కొత్త కొత్త ట్రీట్మెంట్స్ కానీ వాళ్ళ ఎక్స్పీరియన్స్ని హెల్ప్ తీసుకొని ఇంకా మనం హెయిర్ క్లయింట్స్కి ఎంత మంచి చేయగలుగుతాము, హెయిర్ లాస్ని ఎలా ప్రివెంట్ చేయగలుగుతాము అనేటువంటిది తెలుసుకుందాం. ఈరోజు మనతో ఉన్నారు డాక్టర్ అవినాష్ అగర్వాల్. హీ ఈజ్ అ సర్జన్ అండ్ ఈజ్ డూయింగ్ ఎక్స్క్లూజివ్ హెయిర్ ట్రాన్స్ప్లాంటేషన్ సర్జరీస్ since 16 years. So without further ado, let us start. Welcome Dr. Avinash to our podcast.
Thank
How
you.
Are you feeling today?
Yeah, feeling great and very excited, I think. I think we can explore new avenues and new understandings between subject when two doctors known so well in the industry can talk.
Yes. You've been a friend of mine since such a long time, so it's a great pleasure to do an interview with you.
Thank you so much.
So
I'm pleased actually, I would say.
I'll be shooting some random questions.
Absolutely, go ahead.
Before we jump into topic, why don't you just tell me a little about yourself, your journey in becoming an exclusive hair transplant surgeon?
Yeah, so definitely it was the times when started off, of course, in 2006 and 7 when I had just finished my masters and I wanted to get into plastic surgery. That was, of course, the main forte that I decided that I should get something that would entitle me to do something what plastic surgeons do as well. And very excited, I joined in a course, but unfortunately the course had to be cancelled. But I realized that the doctor there, if I could mention the name of the doctor, Dr. Johnwatts, she suggested that you should go to New Heart. New Heart is an American hair transplant company who have more than 12 centers all over the world and about 7 centers in the west coast of the US. And they must have done more than around 4 lakh plus surgeries by then when I joined. And then surgeries were still counting on and they were waiting for surgeons to join it because they wanted to have a new center opened up in India. And that's where my journey started in 2008. I got trained with the doctor called Dr. Mark Bowles, Dr. Philip Wellens, a plastic surgeon from France. And that's where my journey started of hair transplants. I learned from them and I came to India and I started practicing right in there. And I was exclusive. I was absolutely decided that I should only do this and not go back to my surgeries and not go back to any of my other procedures. But yes, 16 hard years of having to do a transplant exclusive surgeon. And of course, that made me explore this subject even more. So that's the beauty of having to be an exclusive surgeon.
Great. I think you got some great doctors to assist you and to teach you.
Yes.
That's a wonderful opportunity. What you told me right now is your journey from you becoming a doctor to you becoming a hair transplant surgeon, exclusive hair transplant surgeon.
Absolutely.
So we really want to know the most important things that shaped you to become doctor and maybe some earliest influences you must have.
Yeah, I think in the Indian societies it is a very common thing that you have elders who always keep telling, Mera Raja Beta will become a doctor or something like that. This is the kind of words people use.
Happens.
And when you have your grannies and your uncles and everybody, because of course in my family, my maternal family, there are quite some doctors. So my mom also had this kid, if I could influence him, that somewhere he should become a medical personnel. And I did, of course, after my 12th, joined in pharmacy. And for 3 months of pharmacy made me realize that probably pharmacy is not my game. I think I want to get into medicine. And I really waited for that seat to get vacant, where I got a seat in D.Y. Patil, Kolhapur first. And then I was moved to Kolhapur, say, in Bombay, because of course there was another vacancy that created. So I had to really push myself hard to get back to my first year, because already I was 3 months old late and I was not in line with my colleagues. But yes, fortunately I did clear my first year in medicine for the first attempt. And but of course, yes, the second year I did have a couple of subjects which was lost, but of course in 6 months I recovered them. And then of course third year, you know how it is. So I think back then Mumbai University had a very different way to approach MBBS and medical career, because it was a 1.5 year, 1.5 year and 1.5 year. That's how the first, second and third years were considered. and then there's a 1 year internship that is later on, and of course if you have a rural service, that also is added. So for me, joining my post graduation immediately, and that's also a very big turning point, because I realized that I had the wit of a surgeon. I had the eye of a surgeon, like the eagle's eye, and my memory was picturesque. And that I could remember things so very well and so sharp, and I could describe everything in that picture. My teachers told me that I think you are meant to be a surgeon. Your hands, and they used to look at my hand and said that this is a surgeon's hand. I was like, are they not really pushing me too hard? So I think then that's what I decided I should be a surgeon. And then again, to be into aesthetic and cosmetic, where I realized that I liked beauty, and I think my most lovely statement to talk to my patient when they come to me, that look, beauty lies in the eyes of the beholder. Said who? Shakespeare. And that's where I tell people, if that beauty lies in the eyes of the beholder, is what you are telling them to describe themselves with, because they will explain you what they want to make themselves look beautiful with. And right from hair transplant, like picking the face framework, or looking at their hairline, or looking at what they want to start looking more perfect in their face, I would rather suggest them what can be done best. So that's where my journey from medical as a child, maybe in school, being very diligent. Of course, I would never skip from the first or the second rank in my classes. And of course, in the near future, you realize that no, that doesn't work in the medical career. So probably I would be the last 10 or maybe last 15 of the medical thing. But yes, I realized that it was not important. It was important that you understood the subject well. If you understood anatomy well, you could be a good surgeon. If you understood physiology well, probably you could also be better at your internal medicines and other scores. So I personally believe that if I am doing good at the subject, let me take this subject also as my profound way to aesthetic and beauty. So that's what's influenced me major.
But yes, what you said, I think our parents are the first persons who sow the seed
in you.
That you should become this, or no, they create that dream and somehow they plant it.
Yes.
And slowly
grows with you. It just grows with you so much that you work so hard towards it.
Yes.
That's what I tell people. In today's time, people say talk about manifestation, talk about it is manifested already. So you have to know that your system is working anyways hard towards what has been told to you that day one. When you got somewhere and then somebody probably demotivated you, and then you said, no, I am motivated enough. So you already manifested, and that manifestation is showing presence, right? So
truly. That's a marvelous thing. You've been teaching SMP for a lot of doctors.
Absolutely.
And you have been doing SMP since a long time. What compelled you to add this SMP skill set into your kitty? And why did you feel that SMP is really important?
Yeah, so patients definitely came for hair loss. And then somebody who had already lost their hair. So hair fall is one part which I tell people कि बाल गिर रहे हैं तो वो बाल आ भी जाएंगे. But जब hair loss हो चुका है, there is no growth, and that's where the deficient spaces they want to cover it. So what best as a camouflage technique? And I knew, of course, that time hair fiber, a very well known product which is like hair which has been pulverized and made into a powder. Then you just spray it on the head and they stick to the hair by electrostatic energy. And they can make your hair look voluminous.
Yes.
But it has a downside and a fall where you go to a shower, the fiber will be gone. You go to a pool, the fiber is gone.
You will see the black sweat coming out.
Exactly, and that's what is so embarrassing.
Yes.
And then what could be next after that, which happened to be scalp micropigmentation or trichopigmentation, or these are the kind of words which people have been putting. But I would say using definitely a very brilliant technology for leaving organic pigments natural in the scalp skin, but in the basal layer of the epidermis, which I tell it's not a tattoo. Which a tattoo, when people say tattoo जो है dermis में है, permanent है, ये आपका epidermis के basal layer में है और semi permanent है. It is not going to be lasting your life, but it can make you avoid the use of your fiber. It will give you a camouflaging technique, but that's only about where patients are still losing hair but wanted to grow back, with of course treatment program like minoxidil, nutrient cyclical therapy, laser light therapy, or growth factor injections too. Of course, patients who already done transplant, उनके लिए भी बहुत ज़रूरी है, because I always tell myself I'm not a god. भगवान ने जो हमें density दी है बालों की per square centimeter is beyond 120-140 hair per square centimeter. अगर हम कहें प्रॉपर, अगर सर पे किसी ने कि नहीं होंगे बालों को, ऑफकोर्स 1 से 1.25 लाख बाल हमारे सर पे होते हैं। एंड उन बालों में से अगर आपकी डेंसिटी 50% जो यूजुअली आपके फ्रंट साइड में होती है, 50% आपके साइड और बैक में होती है, सो दैट हेयर इफ इज लॉस्ट, यू कैन नॉट गेट बैक 50% हेयर. A transplant surgeon can maximum, in my capacity, what I have tried is about 55 to 60 grafts per square centimeter, which is way ahead I'm talking of, because of course जहाँ hairline ही बहुत strong देना है, and patients are okay to not have hair at the back and they put something like a cosmetic piece or a wig, you can say, something which is very easy to stick onto the skin. तो वो लोगों को हम इतनी density दे सकते हैं. But अगर हमको पूरे scalp को density देनी है, because you lose usually hair from the front to almost up to the occipital region and leaving about a finger away. So that area you need to cover with minimum of 8 to 9,000, maximum 12,000 grafts. अब वो सारे grafts जो हैं
really difficult to get
from the donor. कहाँ से लाएंगे? So then to bridge the gap between doing multiple sessions for hair transplant even before density, you would want to do something like a 2 years, 3 years wait, where some of the hair quality will get better, and of course patient probably would now be willing to take some beard hair, chest hair to put in the scalp. So that bridge is the SMP, and that's where I realized ki I have to get this technique mastered, and what better than teaching. Then I realized that if I teach, the more the master I can become. So we have a master class by Tejko Vision, that's the name. I would definitely announce that as well in your talk right now, because we do take trainings for doctors all over India. And I have trained 290 doctors till now.
Wow.
And many aesthetician doctors also who are purely practicing aesthetics.
Yeah, that includes me. That includes me.
No, you are kind enough to actually have this included in your practice, because with such a vast hair transplant practice, I think it is a mandate, and which is beautiful. So
yes.
I really appreciate that you also took participation in this, because that bridge I had to put that end to that thing, when that was SMP. And SMP really changed a thought to many people, because they wanted to go for transplant the very next year or very 6 months later, and I wanted to wait for some more time because hair is still growing, and I have sometimes patients have little arrested growth, or the growth is little delayed, and I want to still buy some time, and that buying time was use of SMP.
Great. I've seen some guys who have got who had full head shaved look with SMP. And I have not seen in most of the Indian patients, but when I go abroad and overseas, I've seen in UK, people easily flaunt the bald look. And we see in the Hollywood as well, people easily flaunt the bald look. But we don't see that much in Indian media or Indian film industry, and people don't like to go ahead with the bald look or fully shaven look, let us say. That's
for obvious reasons, I think, because their spouses never like them without hair. So even if you don't have hair and you don't plan to do transplant, you have an option, wigs. So people go for some other options, but they would want a head full of hair. That is the phenomena that you see. It's not just India, I would say all Southeast Asia, Asia, all over. They are not very akin to doing the head shaven look, because first of all, I think maybe the head size, or maybe you can say the head size ratio to the body ratio, plus or the shape of the scalp. I would say if somebody has a really beautiful shape of the scalp, it's fantastic to flaunt a bald look. But I would still personally say that transplant or any procedures that would cover the bald patch, you can definitely shave your head as well.
How do you look at a standalone SMP as a hair restoration method? I mean, do you really recommend that, or what is the acceptance rate of clients? Do they really feel comfortable once they get it done?
Yeah.
Why I'm asking this, because I have seen some guys who got it done, and they came to me for a repair transplant kind of thing, and what I've seen was an entire scalp which was painted in green.
Yeah.
So I would not like to take names and all, but the idea is that people are constantly missing the point about the epidermis and the dermis thing.
Yes, they're going like a tattoo. They're filling up the whole scalp. They're going so close that the pigments just merge into each other, and the whole layer becomes like a single layer, as though you just put a layer of kajal on the hair.
So do you think that we can really excel in a standalone SMP as a treatment module in Indian scenario, let us say?
Yes. Again, it is the lifestyle that really bother you, because when you do an SMP, your SMPs are something that needs to be cared for. The colors will get fade out if you are a swimmer, or if you are into gym and sweating a lot, or if you go to the sauna and steam regularly, or if you're doing any kind of applications like peels, or maybe any kind of retinol or anything like that on the scalp also. If in case you're putting on the face, of course some of it will get absorbed in the scalp as well. Now, keeping all that in mind, you will lose the color very fast. And that's what makes people more worrisome, that how often can you actually go in and do the SMP all throughout your life. Probably I would suggest my patients that you would do that every 2 years, maybe, and a touch-up session may be required after 6 months in some spots where the color is missing. But that regularity for the patients to get in is still a dream for me. I have seen patients who come in, they would do it only for the temporary relief of the upcoming event that they have. They would probably do for reasons where they have a wedding, or they have some kind of social event which is very important. So they would have that camouflage look fantastic, but then after that forget about you, who you are and who. So I think it's every day convincing, every day understanding the patient's requirement is important. But again, will only SMP be the part of restoring hair and getting your hair looking like full? I don't think in Indian scenario that can ever happen. So that is still a big question. But still I do propose patients that this is a possibility in grade 6 and grade 7, which is so beyond that they would really have no much of result even after having done multiple transplants and try to take all the body hair and all the head hair and all the of course which are available and which can be generally taken from not having to leave the donor completely sparse. They should use that technique, but still they would not look natural, and that's where there is a fear where using only beard, not for the hairline for sure, only chest hair for the filling in, not for sure. So many people do come and demand this. They don't take anything from my head and just take all the beard or take all the chest hair and all the hand hair, leg hair, whatever possible you can take, just take them and put in my head. But how unnatural is what they would look. Because at least for the hairline, I want something from their donor area. And if the donor is really grade 7 and super sparse,
really so it is better to go to SMP.
I would just ask them to shave off the head and do an SMP.
Now the question is, we Indians, we have a tone of color, more of brownish.
Brown color.
And in Caucasians, the color is white. Now, when you do a head shave on the back of the scalp, even if it is a grade 7, the hairy area looks little greenish.
Yes.
So when you match the pigment with the green, you can actually give a very great look for a Caucasian who is too white.
Yes.
Now, does that work properly with the Indian skin tone?
Yeah, so again, Indian skin tone, as we know, either you can say they have a undertone and they have a actual real skin tone. So the skin tone could be fair, very fair, dark to medium brown or dark skin. So if you say on Fitzpatrick scale, we have we are on 4 and 5.
Yes,
that's what the Indian skin type is.
4 I guess, right?
4 I guess, absolutely. So keeping that structure in mind, you have to see the undertone of the face where you select the color that you're going to put in the scalp skin. Matching to the hair that they have, usually most of the people will have dark brown or ash brown or maybe black coffee kind of a color, which I would always suggest there are colors available such. You can match to the hair color, plus you need to see the patient's skin tone and the undertone. Now to detect the undertone, of course you take my master class. So once you know that, of course you can choose the right color and put that kind of a shade which will not turn green or blue, or of course if you say that yes, people have issues who've done it and their color is all matte red, or of course there are ways to remove those colors. So there's the color lift which is available that can lift the color away. There is something called as a red and blue corrector which can use to correct the red color. If the color is faded and become more red, then there's a red corrector. Then if the colors become more blue or green, there's a blue corrector.
Great.
Or purple corrector. So these are the colors which are also available that can help you remove those bad colors. But again, of course, it requires a lot of precision. It requires a lot of expert hands and the right way and technique to do it. So most of the people who do the scalp, it's a large area to finish and cover. So I would suggest patients that you just get a laser. Exactly. Just get a laser.
Simpler, right?
Easy way to get the tattoos out. But of course, you will lose your hair also at the same time. You will bleach your hair, whatever's available hair that you have. But eventually, with time, the hair will revive back if they are supposed to stay and survive with you.
So the color corrector thing will work if it
Or
is a
smaller
small area,
folds,
let us say
exactly.
like maybe in the eyebrow area,
The
you can do the
eyebrows,
color.
or somebody, of course, people nowadays also do for their temples. So ladies who actually have a bun tied, they would prefer to have the temples filled with color.
Yeah.
So they can do microblading as well on the temple
Yes,
area.
yes, that's
so
a
a lot
great
of
way.
scalp pigmentation
That's a great way.
are also changing day by day with the newer technologies where we have dots, we have dashes, we have pigments left by microblades. So scalp pigmentation is also changing in big way.
What are the biggest mistakes, be it physicians or SMP artists do while they are trying to revive the look or while they are trying to get back the hairy look? So, what are the common mistakes? I mean, with the patients who come to you, who have already got it done elsewhere.
So I've seen that they typically use the tattoo nib, which is again the very wrong kind of a needle that is being used.
To start with itself, they have
Yes.
decided it as a micro tattoo.
As a tattoo.
And that's what, in the name itself, they are
Publicizing it also as micro
they are
tattoos.
making the mistake.
Yes.
Yeah.
So kind of using those nibs are the wrong way to begin with, because the size of the nib typically is nothing but 0.6 mm.
My
So
goodness.
it's 1/6 of an mm. But if you see the SMP needles, or the tip of the needle is 1/30th of an mm.
Wow.
So it's 0.03 mm as the thickness of the needle. So that fine needle is what is required. But of course, if you are looking at a bundle of hair, which is the follicular units of 3 hair, 2 hair, you will have to take an advanced needle, which is about 3 plugged in together. That's called 3P
3-prong.
or 2P. Exactly.
Yeah,
They're prongs, or you can say plug, or whatever is suited.
Got it.
So you get that numbers of hair together, which was showing as 3 hair coming together. Or if they are left for a little longer in the skin, it coalesces and form a larger drop. So that shows of thicker hair quality. So if you are choosing the right nib for the patient, plus you are evaluating the donor density by doing a densitometer test, and you know exactly what number of hair that you want to plant, you can actually sit and practice first for you know, like a latex skin which is available, artificial skin, that you want to do this. So that same precision is what you can continue doing all over the front also. Of course, hairline has to be even softer and the temples even more softer. So that is of course the technique that you keep learning with time.
So let us say the difference between the tattoo nib and the SMP nib is
way different.
30 times less thicker than the.
Absolutely.
Yeah. That is how. Though you are making so many dots in that area, but when it comes out in a
actually each dot represents each hair.
Each hair.
That's
hair
what each strand. Exactly.
Okay.
Of course, they're not growing. It's just the visual look of the strand that is still standing there, like a 3-dimensional look. But it's not going to pop out into a hair, unfortunately. So it is exactly, the word is simulus. It is not a stimulus to hair. It doesn't make it, it's a simulus. So the word is not stimulus.
Yes. Some patients really hesitate about SMP. Whenever even I tell them, they fear that it may look fake, or it may look unnatural, or they may look out of the place, or sometimes they feel that it will look as if somebody has done a sketching kind of thing. So how do you convince?
So I do explain them if this question arises. I tell them, if somebody comes very close to you, less than even 12 inches close, who would that be? Your girlfriend? Your wife? Besides which, nobody would come that close to you. They will notice that something is being done on your scalp. But the moment you are about 2 feet away, when I'm talking to you like this, I would see your scalp looking full. That's all I would see. So that is where the beauty of using magnification while we're doing this procedure, or something which is so closely done that from far or from a distance like this, it is very natural. But the moment, of course, you come very close to the patient, you will see that I can see these dots which are not like, the real dots, of course, not hair coming out of the head.